So here in Minneapolis, we're doing a 2-day exclusive event with Henry Schein. Dr. Charlier is the instructor, and we have 3 veterinary technician specialists in dentistry that are teaching the technician portion as well as the veterinarians on various topics.
The first day of the training is for technicians and doctors, and we'll go through in lecture format tooth anatomy, radiograph interpretation, steps involved in oral surgery, and pain management for our patients. On day 2, the technicians will learn how to do supragingival and subgingival scaling and polishing, probe and chart, and take full mouth radiographs. By the end of the second day, the technicians should have all the skills they need to perform excellent patient care in the dentistry area of your practice. For the doctors on day 2, we'll learn how to do local or regional nerve blocks and also learn the steps involved in oral surgery. By the end of day 2, the veterinarians should be pretty comfortable doing oral surgery on most patients that walk through the front door.
A lot of what I learned was that no matter how good of a job you think you're doing, there's always room for improvement.
A lot of the feedback that we get is just really, how excited they are to go back into their practices and really change the way they were doing things and really implement and apply a lot of the things that they learned in the lab immediately.
I would definitely recommend anybody who could to go to these training sessions. You learn so much information, so much to bring back to your clinic to help improve the whole entire clinic.
Well, there's going to be various levels of expertise here. We've got beginners to veterinarians that are practicing in a high volume practice where they're marketing it every day and they're performing dental procedures under anesthesia on a daily basis. So we've got everywhere from this is their first dental CE to clinics that are pretty advanced.
So I knew we were going to have a lot of support coming here, and I knew that we were going to get to learn a lot of things that you weren't going to be able to learn at your own clinic, just trying to get better on your own.
So hands-on is the perfect time and perfect opportunity for these doctors to learn how to use a high-speed handpiece, learn the procedures, and make mistakes. If they're going to make mistakes, we want them to make them here so that they lessen the number of mistakes that they make clinically.
You can't get it any other way but hands-on. Somebody can tell you a million different times, but until somebody's actually showing you, looking over your shoulder, telling you to change your angle this way or to do this way or to hold 5 seconds longer than I was, it's invaluable, completely invaluable.
You can read as much as you want online, you can watch as many online videos as you want, but unless you're in a classroom and having someone talking directly to you, showing you by hand what to do and how to get these tips just a little bit better, that's the only way you're really going to get that bigger push in terms of the quality of your work.
If there were other veterinarians or technicians that were interested in doing a dental program, I think this would be a very valuable lecture and wet lab to go to.
We have doctors that have learned nothing about veterinary dentistry through vet school, that have been out in practice 2 years, 5 years, 10 years, that come to these seminars, and it opens up a brand new world for them. And they're so excited at the end of the 2 days about how much better they'll be able to treat their patients when they get back into their practice on Monday.
I recommend that every veterinarian go through not only this, but even return to this type of education on a regular basis. I think there's always something to learn, and it's important as veterinarians that we're always pushing ourselves to make sure that we're doing the absolute best we can for our patients, for our clients, and just to reach our own personal goals.
We had a technician last week who sent us an email saying she'd been a technician for 16 years, and she really didn't know what she didn't know until she came to this meeting. And she thanked us for totally changing the way she would practice from this day forward. That's the reason we do these seminars.